Ankle sprains. Sprains occur due to stretching or rupture of ligaments, which are strong fibrous bands that bind the bones together. Ankle sprains are the commonest injuries responsible for ankle pain and can affect almost anybody at any age. The pain is usually aching or blunt and can range from mild to severe depending on the degree of damage to the ligaments. The most common mechanism of ankle injury is inversion of the plantar flex foot, which is this. This causes damage to the lateral ligament complex of the ankle on the outer side of the ankle. This ligament complex consists of three ligaments: the front or anterior talofibular ligament and the back or posterior talofibular ligament, both connecting the talus to the fibula, and the calcaneofibular ligament, which connects the calcaneus to the bone of the fibula. The anterior talofibular ligament is the first and usually the only ligament to be injured in the majority of ankle sprains. Medial ankle sprain is quite rare, since the medial deltoid ligament complex, not shown here, is the strongest of the ankle ligaments and is rarely injured. Some cases, especially in contact sports, can result in high ankle sprain, also called syndesmotic sprain, where the ligaments connecting tibia and fibula bones are involved. This type of injuries can lead to chronic ankle instability and are more likely to result in recurrent ankle sprain. Causes and risk factors for ankle sprain. Ankle sprains can occur at any age, but still there are some risk factors. Lack of strength and flexibility of the ankle, inadequate or no warm-up, advanced age, poor balance, sudden acceleration or deceleration in movement, previous poorly healed ankle injury, walking or exercise on an uneven terrain. All of these are risk factors for ankle sprains. The clinical complaint of ankle sprain. Pain is the commonest symptom, along with swelling with or without accumulation of blood, stiffness, and instability of the ankle. Instability is more common with completely torn ligaments. In mild injuries, there is a minimal tear and the pain is also milder. In moderate to severe conditions, where there is a considerable damage to the ligaments, the pain can be intense with gross instability of the joint and trouble putting weight on the ankle. If there is a severe tearing, you may feel or hear a pop when the sprain occurs. This mandates immediate referral to a consultation. Making the diagnosis of ankle sprain. The doctor will get a careful history determining details on the injury, like the type of injury, mechanism, the ability to bear weight, and past injuries to the ankle. The physical examination will consist of gently palpating or feeling the leg bones, the Achilles tendon, and around the ankle joint to determine which ligaments are injured. The doctor will also gently move the ankle in inversion, eversion, plantar, and dorsiflexion. He will also perform some other tests, such as the squeeze test, which consists of compression of the fibula against the tibia, and also the anterior drawer test, to detect excessive movement of the talus on the tibia, which is this. X-rays are usually needed to exclude an associated fracture, which is fairly common. A set of guidelines called the Ottawa Anchor Rules are used in conjugation with radiographs and help in minimizing unnecessary X-rays. MRIs are done when suspecting a severe injury with completely torn ligaments to evaluate and to decide on the proper treatment. However, MRI examination is usually done after the swelling subsides. Ultrasound examination is another great way for the doctor to directly observe the behavior of the ligaments with the ankle movement. The treatment for ankle sprains. The immediate treatment is crucial for minimizing the ligament damage and the progression of the injury. There is an outstanding protocol named RISER, which means R stands for rest, by using crutches and staying off your feet. I is for ice. Apply a cold gel pack, bag of ice, or bag of frozen vegetables on your ankle every 1 to 2 hours for 15 minutes each time. Put a thin towel between the ice and your skin. Use the ice for at least 6 hours after your injury. Some people find it helpful to ice longer, even up to 2 days after their injury. Compression, having your ankle wrapped in an elastic compression bandage. This helps reduce swelling and supports the ankle. An air cast is also a good option. Elevation means you should keep your foot raised up above the level of your heart. To do this, you can put your foot on some pillows or blankets while you are lying down, or on a table or a chair while you are sitting. And the last R is for referral. Seek professional medical help. Strictly abiding to the protocol can significantly minimize internal bleeding and progression of the tear. Non-steroidal anti-inflammatory drugs can be used, like ibuprofen, naproxen, and others. It is vital not to stop moving the joint. Physiotherapy and exercise with mild painkillers combined with local topical therapy are usually enough for mild to moderate injuries. Once acute pain and swelling subsides, plantar flexion and dorsiflexion of the foot and doing foot circles should be started early. This is to maintain the range of motion. Wearing an ankle brace like an air cast, which limits the armful movements and promote healing, will be suggested by your doctor. You should not indulge in any vigorous exercise involving the ankle for at least 3 to 4 weeks after the sprain. While mild to moderate injuries resolve spontaneously with time, severe conditions with completely torn ligaments may need extra care. Severe cases may need complete restriction of the ankle, unlike in milder ones. Surgery is a viable option when the injury doesn't improve with the non-surgical treatment. It should be considered in some patients with severe sprains who are engaged in professional sports or other activities that are likely to impose repeated stresses on the ankle joint.